Okay. Which of the following is the most appropriate next step in management? Okay, chemo. A 42-year-old woman presents to her gynecologist with complaints of abdominal pain, bloating, denies any fever, nausea, vomiting. Uh, she has a history of irregular menstrual cycles, and her last menstrual period was 2 months ago. Her vital signs are stable. Examination of the abdomen is distended with a palpable mass in the lower quadrant. Ultrasound reveals a large multioculated cystic mass in the right ovary. The patient undergoes surgery, intraoperative finding confirm a benign cystic lesion filled with thick gelatinous material, which of the following is the most appropriate next step in management? Okay. So she had a mass of her ovary, and like some, I mean, at least for some of the OB things, like the descriptors kind of point you towards what kind of ovarian issue you're having, like multi-oculated technically, but we're seeing the treatment. So I wonder if regardless of, well, it's benign, it confirms a benign cystic lesion, but it has the gelatinous material um, in the radiation. I think because it's benign, you're not going to do anything really aggressive, and then I
Okay.
assume, I assume down the road maybe, like I think thick gelatinous. I don't know if it's trying to imply like a cyst or something like that, but because it is benign, I think it's just observation and follow up imaging, and you
Okay.
know comes back, then you would do fine needle aspiration or something like that.
Okay. Okay, let's kind of figure out kind of what's the diagnosis first, right? Abdominal multicystis consists of ovarian cyst, mature, right? Cystic teratoma, and the reason, let's see why they say that here. Cyst can be benign, managed surgical immune, and fallopian tube. This preserves the fertility in this. Let's see, menstruals, distended palpable, ultrasound, multilocular cystic mass, undergo surgery, intraoperative findings considered benign cystic filled with thick gelatinous material. Um, Cystic teratoma. Okay, dermoid cyst. Okay, so I think that let me see kind of why here. Maybe appropriate for small, simple ovarian cysts will likely resolve on their own. However, given the size and complexity of the patient's cyst, surgical intervention is warranted. Okay, this is kind of an interesting thing, right? So it depends on. I don't like this question too much. Probably will throw this question out. But if you think, look at it, I think your answer is actually correct because it doesn't give you what surgery she underwent, right? Because
Yeah.
at the same time, before they do this surgery, I would assume that you would do a unilateral salping oophorectomy, right? Because you want to take everything out on this side, right? It's a complex mass. You can't just partition it. You got to take out the whole thing.
Right, right.
So I'm assuming it's kind of a weird question because they don't tell you what surgery she underwent, right? Was this a biopsy? What was it? If it was a biopsy, right, they opened her up, took a piece of it, and it showed this, then yes, the next step would be to finish up the surgery and just take out the whole cyst, right? If they did the whole surgery, which should have been a unilateral salping oophorectomy, right, then of course your answer, observe and follow up imaging, would be completely fine. But the key thing that learning wise here on this question is that this is a complex mass, right? Complex masses you can buy. I mean, complex. I mean, simple cyst. What you can do is you can biopsy. If it's benign, then you can leave it alone and follow it. If it is large, multi-loculated, causing issues and symptoms, right? Like AKA abdominal pain and bloating, right? Those are symptoms. Then you're gonna want to take that out because it's not gonna go away by itself. So that's kind of the learning point of this, depending on its complexity. But not a great question due to the fact that they don't tell you what surgery the patient undergoes.
I
So
think another thing too is when I see that term multi-oculated cystic mass, I I also think I think there was like a Anki card or something that explained tubo ovarian abscess, and like one of the descriptor words for it is multi-oculated. So sometimes when I see that, I don't know which category to put in because it's like, is it an abscess or is it I
So
get that.
so that's a good question. So multiloculated just means that it has multiple pockets. Okay, that's all it means. It's not a descriptor for an abscess or a certain kind of thing, right? You need more descriptors. So for instance, a tubular abscess, they're gonna have symptoms of what? Fever, right? Sepsis, right? It could be hypotensive, right? Pain, erythema, right? It's gonna have symptoms of infection. Does it make sense?
So that, yeah.
So what I'm trying to say is multiloculated, that can describe a lot of things. You need to look at the overall clinical picture. So for instance, here they tell you it's a cystic mass. Cystic mass just means like fluid filled, right? So you should in your mind, this is a multicystic, right? Multiloculated cystic mass of the right ovary. It doesn't scream abscess, right? Because she doesn't have any kind of fever that doesn't say, right? It's just really some pain and some bloating, but no fever. They don't talk about hypotensive, they don't talk about erythema. So this is a not infected mass. You get what I'm saying?
Yeah. Does the jig or the thick gelatinous material, is that supposed to tell you a teratoma?
No, no, no. They called it a cystic teratoma. That's what the diagnosis is. But thick gelatinous material just means that it's like thick fluid filled. That's all it is. So you can call it a dermal. It's just a benign multiloculated cyst. That's pretty much what you need to know it as.
Okay, so like I know a cystic teratoma, like when we learned teratoma for step one, cystic teratoma was like the three germ layers and it has, the teeth and hair and all that. And then,
Yeah. So I think if you don't call it, that's just a regular teratoma. A cystic teratoma, I don't know too much about, but calling something a cystic, right, just means that it's fluid filled. So that's why they don't describe the three germ layers here.
okay,
So
okay.
let's see, what's the difference? Let's see. What is a cystic teratoma? Oh, it's also a dermoid cyst, is a type of benign tumor that contain so it can contain. So it doesn't have to. Most commonly in the ovaries, may prevent an abdominal pain, bloating. In some cases, it can cause acute abdominal symptoms. So it doesn't have to, it says, but it can. But the fact that when you call it cystic, then you know that it's more fluid filled than solid things. So
Yeah.